Interesting. Thank you, John. Well, the demand for stronger mental health services for teens has been a long-time need in Central New York. News Channel 9's Adrienne Smith explains how Upstate University Hospital's new program will bridge that gap for the teens who need it the most.
There really was no middle ground.
Dr. Jessica Costosa Iumina is Upstate Medical University's new intensive outpatient program director, and she says there's no other mental health program for teens like Upstate's in the Syracuse area.
There really was, outpatient, and sometimes we would sort of do some stuff in our child clinic to increase our services as best as we could, but we could never get to this level of care. A lot of what was happening was that if teens wanted to do something like an intensive outpatient program, they would have to go to like Saratoga, Fort Wayne.
Not anymore. The new program is aimed at two types of teens who need critical services. The first, those who require a step above what's available with outpatient care, and second, teens who might be coming out of intensive treatments.
So what our program does is kind of bridges the gap between the two. So it's for a lot of those kids that the traditional outpatient psychiatric treatment is not enough for them, and they need more. But we want them to get those services and keep them at home, keep them part of their community, work with their families and work with them in real time while they're experiencing these crises.
The program is designed for kids to have up to 10 hours of care in 1 week, which includes individual, group, and family therapy, medication management, and even coaching.
We're creating a supportive community where they can see they're not alone,
and providing the care so many of our teens need. In Syracuse, Adrienne Smith, News Channel 9.
Yeah, important services. They're still in the midst of hiring staff, but once that's complete, the program will have the ability to help up to 40 teens every single week.